Well, I'm here to explain to you what is going on in America today. This is not an ideological. I know many of you believe Medicare for all is the right model. And I understand that and can be somewhat supportive of, but I must admit, I'm an affordable care guy. I believe the Affordable Care Program is exactly the right balance. But both of us, both groups want the same thing, which is guaranteed, universal, decent coverage for all Americans. And I beg you, as groups, we need to work together. There is another set of forces out there that want to do evil to both of us. And I ask you, Bill, the Academy has to bring us together. This battle between Medicare for All and the Affordable Care Act is going to destroy us both. So here is this, we need to work together. This is not something that we can afford. So here's the story that I'm about to tell you. For those of you who don't spend as much time about the American healthcare system as I do, look at this chart. Beginning in the mid-1990s, we have seen a violation of the Bob Ball principle, which is growing by leaps and bounds. Currently, between that the private sector and Medicare are going in opposite directions. The gap between what private pays and what public pays is approaching 70%, and in many parts of the country, it is over 100%, which means the same kind of patients. Now, the private and public are paying privately twice as much as Medicare. This is not healthy. This is not good for Medicare. Now, this is exactly what Bob Ball argued against, and he was absolutely right. We cannot see Medicare and the private insurance market move in opposite directions. If we do and continue to see that, you will see Medicare beneficiaries becoming denied access to care. Fortunately, currently, I know of hospitals are denying Medicare people. And I'm a Medicare recipient. I've had wonderful care from Medicare, although I wish they'd send me balloons when I got operated on. But that's another question. The point here is that this gap is getting wide, and it is not. Now, if you flip from hospital side to physicians, we're already seeing the canary in the coal mine. More and more primary care physicians are now going to concierge medicine, which I believe is immoral, unethical, fattening, and I must admit I joined it because I've lost 3 primary care physicians in the last 4 years. And if I went around the room, you will find several of you who are already having, because they feel that Medicare is no longer paying them an adequate rate. Now, I'm not here to argue whether Medicare is the right number or not, and I'm not here to argue whether Medicare should raise the rate. What I am saying is that this is a dangerous for Medicare and for the rights of others. We have to work to figure it out. Maryland and Massachusetts are trying to make a difference. And I would encourage you to look at what we're doing in Massachusetts and Maryland to try to make sure that this gap does not get wider. But the important thing that I want to bring back, and bring back how wise Bob Ball was, it is a bad public policy for these 2 important programs to become so widely different. And as I said, over the years, I really began to appreciate how smart he was and how stupid I was. And I hope I've learned a little bit. So, in closing, you know, Bob Ball was an incredible human being. He represented the best of civil servant, as you pointed out. I wish I was smart enough at 32 to appreciate that. but I implore all of us, we need to work together. It is so important that the American people get a comprehensive, decent healthcare system. Medicare for All has a lot of advantages. I'm not arguing against it, but it has some big disadvantages, particularly in terms of this. So we need to work together, and it's your responsibility to bring us together, Bill, and make this academy, make us both work together so that we can find the right solution. What a pleasure it is to have the Bob Ball Award. I want to thank you, Bill, for giving me this opportunity. I want to thank, Chris for, bringing, Bill Clinton on the scene, and Karen and Chip, I mean, the idea that Chip fired me is that, I haven't recovered yet, but it's all right. So thank you all very much. This has been a wonderful opportunity.